I'm Dr. Jennifer West, and I'd love to chat with you about the top 3 reasons to bring your cat into a veterinary emergency hospital instead of waiting for an appointment with your regular veterinarian. Number 1 is their breathing. Number 2 is are they eating? And number 3 is use of the litter box. So starting with number 1, their breathing has 2 components: the respiratory rate, which you can get by counting their breaths over 15 seconds. Count as inhale, exhale is 1 breath. And once you get that number, multiply it by 4. This gives you the breaths per minute over 60 seconds. That number for a normal cat should be less than 40. The best way to be sure of that is you can count your cat's breathing rate when they're not at play, when they're resting, and when they aren't feeling sick. The other part of breathing for cats is their effort. Cats should never have an open mouth when they're breathing. They are very different from things like lions and tigers, where they can actually pant. Cats should never do that in the household. So again, if their breathing rate at rest is over 40, and or if they are opening their mouths to breathe, you should really get them checked out sooner than later. Number 2, is your cat eating? Cats really can't go very long without food. Even just 2 days can be a life-threatening concern for your cat. The reason for this is they actually break down fat stores very quickly, and this fat goes into their bloodstream and goes to the liver, where unfortunately they can develop a condition called hepatic lipidosis or fatty liver disease. That condition in and of itself can be deadly, and the way you can prevent it is getting your cat in sooner than later so that they can provide medications, fluids, and different things to try to get your cat eating soon. The third thing is using the litter box. So the predominant part of this that we're worried about is your cat urinating, and that can be a much more difficult question to answer if you have multiple cats in your household. If they're urinating in the litter box but you don't know which one did it, that can be difficult to know when they last peed. So if your cat is going to the litter box often, straining to urinate, vocalizing during urination, and or having little spots outside of the litter box, these are all potentially concerning things. Most importantly, if your cat does not urinate for 12 or certainly 24 hours, you need to get them seen very soon. The concern is cats can develop an obstruction, a lack of ability to pee through their urethra, the tube going from the urinary bladder out to the outside world. And this especially happens for male cats. So you want to get them in quickly so that they don't develop a really big issue with their electrolytes and inability to pee. So again, as a recap, is your cat breathing at a good rate and without much effort? Are they eating? And lastly, are they peeing? Hope that we'll see you soon. Come on in.